And sir also worked as health policy analyst, health technology assessment in India Secretariat. And the, and he has a proven track record in HTA, reimbursement policy advocacy and implementation, collaborating with top level management and policy decision makers across government, medtech, and policy think tanks, and ensures effective policy decision making. His experience includes collaborating with National Health Authority, Central TB Division, ICMR, DGHS, and state government. He served as a national nodal officer for the procurement and distribution of diagnostic machinery and testing kits during the COVID-19 pandemic at ICMR. And during the pandemic, Sir was a member of committee constituted by DHR to review the supply versus demand gap of the Indian COVID-19 diagnostic market to understand the changing scenario of testing status and availability of testing kits for decision making regarding export permission. And we are very honored to welcome you, sir. Please welcome, sir.
Hi, good evening, one and all. I hope I'm audible.
Yeah, sir, you are audible.
Thank you for confirming. Thank you so much for the introduction. I will just try to share my slides. Please confirm once it is visible. Can you see my slides?
Yeah, sir. Yeah, sir, screen is visible. You can continue, sir.
Thank you so much. First of all, I would like to thank the organizers for making me part of this wonderful program. So, myself, Jagdish, I'm the General Secretary of Association for Doctor Pharmacy. And today I'm going to talk about health technology assessment in India. What are all the opportunities that PharmD graduates have in this particular area? Let's discuss about it. So I will be talking about what is HTA and what is HTA and where it is established and what is its importance in taking a policy decision in India and how it is influencing the health policy decision making in India. Then I will throw some light on the career opportunities available at HTAN and their centers across India and some ICMR recruitment rules and what are all the job opportunities that we can get it in ICMR institutes. So first coming to the health technology assessment. So basically health technology assessment is a multidisciplinary process that gathers policy relevant evidence about the medical, economic, social, and ethical issues. So that means it is helping in generating some evidence based on the clinical effectiveness and the cost effectiveness of any technology by considering its social and ethical issues related to any health intervention. So I will talk about these interventions in upcoming slides. So this HTA is a process that we conduct in a systematic, inclusive, transparent, and robust manner, so that it will help in a policy decision making in healthcare. So these are very helpful, as I said, very helpful in formulating the policies, either by including the new health technologies that introduced in the market or by excluding the existing health technologies from the health system. So the health technology assessment in India is an attached office right now under Department of Health Research under Ministry of Health and Family Welfare. So under Ministry of Health and Family Welfare, we have two departments. One is Department of Health and Family Welfare, where all the health schemes are undertaken, and for the research, we have Department of Health Research, under which all the ICMR institutes and all comes under DHR. So under DHR, the government of India has established HTIN to undertake these health technology assessment studies. The core aspects of this health technology assessment is, health economics, nothing but, your pharmacoeconomics studies like cost effectiveness studies, cost utility studies, cost benefit studies. So basically, we perform, HTN perform these studies at DHR, thereby helps the state and central governments in the implementation of the health policies. So under when I say technology, so these are the different technologies that we consider for the assessment. So a technology could be your drug, or medical device or any vaccine or any surgical intervention or health programs. So any strategies if you want to include in health programs, whether it is cost effective or not, that we can assess through the HTA process, and we can provide the policy decision recommendations. And so the while performing HTA, they usually consider the clinical effectiveness of that particular technology, be it drug or medical device or any other technologies that I said. And they will look into the cost effectiveness of this particular technology. And apart from that, they also do the budget impact analysis. So budget impact analysis is nothing but, when you want to introduce some new technology into the system, how much budget it is required, that also we have to check out, because whether that much budget is available to include or incorporate into the existing program or not, that we can see. And we can also check the feasibilities and equity and ethical issues. So all the devices may not be ethically or feasible in the field. So these aspects also will be considered by doing these HTA assessments. The major objectives of HTA are, maximizing the health. So without compromising any quality of the health services that we are producing, we try to better utilize the minimum resources that are available. The main motto or agenda behind the HTA is to better utilize the minimum resources that are available and how can we maximize the outcome. So resources are always limited in any kind of healthcare setting, be it a developed country or developing country and middle income countries. So everywhere the resources are limited. So how we can better utilize the less resources and how we can maximize the benefits or outcomes. That is the main motto of the conducting these HTA studies or health economic studies or even these pharmacoeconomic studies. So the another objective of the HTA is to reduce the out-of-pocket expenditure, so that the people will not go into catastrophic households expenditures. So that catastrophic household expenditures is nothing but, they have to sell their assets to meet their medical expenses and and again the another objective of the HTN is to reduce the inequity. So whatever the disparities are there between in terms of gender, poverty, caste, disability, and geographical barriers also they will consider while doing any HTA. So sometimes, certain technologies are cost effective in developed countries that may not be cost effective in our country. So based on our GDP per capita, we will decide whether particular technology is cost effective or not. So some technologies may be cost effective in cities, but may not have access to the remote areas. So when you are talking about any technology that they wanted to introduce in a PHC level, primary healthcare center level, so whether these are accessible, whether we can implement these things in PHCs, so that it can be accessible to the remote areas or people living in villages and all that, we will take care of those things while conducting this HTA studies. So, HTA has been established in India in 2017 under Department of Health Research, but HTA is not new to the world. Already there are well-established organizations like NICE in UK and HITAP in Thailand, and we have so many other HTN organizations across the world in Canada, US, and Asia and Australia as well. So you might have heard about the ISPOR also. So it is also undertake the pharmacoeconomic studies and all. So coming to the applications of HTA studies, these HTA studies is basically helpful in generating any evidence informed policy decision making in healthcare, as I said. So we will look into it the technology that is newly introduced in the market, and then you will look at the various aspects, and then we can make the policy makers whether this particular technology can be adopted or not. Such kind of decisions can be taken using the recommendations of HTA. And from the reimbursement packages, recently government has introduced Ayushman Bharat packages, where they cover 5 lakh insurance for the patients. And so there are a list of technologies that are included in these packages, because everything cannot be covered under the PMJY package, so Pradhan Mantri Ayushman Bharat packages. So Jan Arogya Yojana, so Ayushman Bharat, basically the major program. And under this scheme, there are certain procedures that are available. Currently, there are 900 uh, packages that are available in that. So government has decided some rates. So, but whether it is justifiable or not, whether at a particular price, whether any particular procedure can be undertaken at a hospital or not, that we can check out using the HTA studies. So basically, HTN helped in revising these packages earlier under PMJY packages also. And again, reduce the out-of-pocket expenditures. Out-of-pocket expenditure is something like, how much you are spending from your pocket. I mean, any patient spending in their from their pockets to avail the health services at any institute or hospital. So that is out-of-pocket expenditure. And efficient resource utilization. As I said, with the minimum resource available, how can we maximize the outcome for every rupee spent? What is the benefit in terms of quality of life gain, or quality of life years gain, or quality of life achieved? So something like that we will calculate usually in HTA studies. I'm not going much detail into the technical aspects. And value for the money health interventions, as I said, how much you are investing and what is the outcome in terms of quality of life. And it can also helpful in supporting formulating the clinical guidelines. For example, you might be knowing, like, for example, diabetes is there. What is the first line of drug? Metformin. So metformin, if it is cost effective or not, if there is any alternative medicine that is available which is more effective but costly, in such cases we can check out the cost effectiveness of that particular drug, and we can decide whether it can be kept in the first line therapy or not. So something like that we can take decisions. So instead of metformin, we will recommend some other drug, a new drug, whatever comes. So that's how we do the HTA and give the recommendations. And it will also helpful in strategic purchasing. So during COVID also, we helped the government to take a decision whether to invest on the kits that are available at very higher end than the indigenous products that are came into the market during the COVID time. So that's how it will be helpful in strategic purchasing as well. So we have different stakeholders. So like NPPA, National Pharmaceutical Pricing Authority, Ministry of Health and Family Welfare Department, they rely on the HTN recommendations. Uh, you know, what kind of decisions can be taken on the new technologies. And as well as, central TB division also, they rely on HTN recommendations whether to adapt a new drugs for TB or not. So recently some news has also come into in the CTD portal. You can check out there is one BPAL regimen that was introduced into the TB regimen, MDR TB regimen. You can check out that on the website if somebody is interested. So these all included into the program after the HTA recommendations. So similarly, we have other stakeholders like CDSC, WHO, insurance, clinicians, research, and patient participation groups. This is a, HTA guide manual that is available online. If somebody wants to, look into it, maybe they can check out this manual that is available on the HTN website. You can download it and you can learn the concepts involved in HTA. So how can we translate the economic evaluation into policy decision making? When somebody asks you this question, then HTA would be your answer. So this is an example. So once we complete the HTA study, then they communicate their study results using a policy brief. So this is one of the examples of policy brief. So they have assessed the safety engineer syringes for therapeutic care in India. So they conducted this study was conducted by PGMR Chandigarh. So these policy briefs are also available on HTN website if somebody is interested to look into the policy briefs and type of studies undertaken under HTA IN. You can check out the website. So this is how they communicate. So under the recommendations, see for example here, they have, it is found that RUP, so that is reuse prevention syringes, to be cost effective in Indian context, and they have also given the at what rate it, at what price it should be procured also. So basically there are um, uh, unsafe injections can transmit serious diseases, even to the medical staff, or even to the patients also. In such cases, what kind of syringes can be used to prevent these cases? So basically, they conducted HTA, and they have utilized these three interventions. So RUPA, SIP, and RUPA plus SIP is a combination. So they found that reuse prevention syringes are cost effective than sharp injury prevention syringes. So they recommended government to go for these particular intervention. And after that, after the study recommendations, so government of Andhra Pradesh, they notified one government order saying that HTA has been conducted on these particular interventions, and these can be included in the. So if you look at the second paragraph here, comprehensive health technology assessment report, which provides evidence on transmission CV, basically the infections that transmits through injections. So government, after careful examination, decided for the usage of auto-disable syringes for all clinical purpose, and to declare the government as safety injection use. So this is how the government adopts the HTN recommendation. Similarly, Punjab government also took a initiation to adopt these safety engineered syringes into their programs. So this is a little bit of introduction about the HTA. There are more to talk, but based on the time constraints, I kept very small about the HTA. If somebody wants to know more about it, maybe you can ask some questions. Then probably I will respond on that. Uh, First, let me complete the career opportunities also. Maybe we can keep the question and answers at the end. So coming to the career opportunities, so through our association, we have included the PharmD qualification in the recruitment rules of HTIN. So it has been done like 5 years ago when I joined at HTIN. We requested the DHR to include it in HTA guidelines, and it was included. So now the recruitment rules are publicly available. I mean, these are the recruitment rules that HTA is basically using it for recruitment of various positions that I will show you. And similarly, recently, PharmD qualification was also included in the recruitment rules of ICMR. So again, we requested ICMR administrative. So these are the representations that we have given to ICMR and 2020, and after 3 years it got included into the recruitment rules. So similarly, this was given to DHR HDI in charge, and it got implemented after that. These are the recruitment rules of ICMR. A glance, I have kept it here. So this is an office memorandum where you can see the name of the post, scientist B. Don't confuse by this number of posts. These are the sanctioned posts for the ICMR. So nothing to do with the job notifications right now. So under scientist B, under the education and other qualification required for direct recruitments, they have included PharmD degree. Okay, in earlier you might not have seen the PharmD qualification in the recruitment rules. So after our request, they considered it, and it has gone through all the approvals, and finally, yeah, they have included it in recruitment rules. Similarly, for scientist C position also, you could see the PharmD qualification, and similarly for E level position. So basically the scientist position starts with B, C, D, E, F, G, H, something like that. So, and similarly, these are the screenshots from HTN guidelines, where for D level positions we have included PharmD plus 8 years, and C level position PharmD plus 4 years experience, something like that. So this is the website. If somebody wants to access HTN website, maybe they can make a note of it, htn.dhr.gov.in. So if you look into the HTN website, you will get to see like how many resource centers they are having across India. So currently they have 6 resource hubs across India and 19 resource centers established. If you're not able to see all the list on the website, maybe you can check out the annual reports available on DHR website. So dhr.gov.in, and you can find the annual reports. In one of the sections you will find the health technology assessment, where they must have mentioned all the list of the resource centers and hubs. So hubs are recently approved. I think there are to put it in the website, but these are the already approved resource centers earlier and upgraded to the resource hubs. So currently we have 25 centers if you include both resource hubs and the resource centers. And these are the various positions that are available in all these centers. Let's say in all the 25 centers across India, apart from the positions at DHR. So this is how HTN operate. Basically, HTN, the apex body in HTN is HTN board, chaired by the chairman, member chairman, Niti Ayog, and member health, sorry, Niti Ayog, and they have resource hubs and resource centers working on the HTN proposals, HTN studies, and the technical appraisal committee who supports in developing the. I mean, once the study was developed with resource centers, they will look into it whether it is appropriate way to do it or not. And once they complete the study again, they will look into the outcomes and all. And usually they receive topics from the user departments, but now they are planning to open it for the innovators and private players also. Once they receive topics, they will do prioritization and then they will assign it to resource centers. Once the resource center completes, then it will be approved by the technical appraisal committee TAC, and then it will go to board. The board will approve it. Once it approves, then only it will be communicated to the user department, whoever sends the topic for HTA. And these are the different centers that are available. So you can check out in the website also, htan.dhr.gov.in, where you will find the different map on the list of the centers that are there. So, for example, you can look at one of the resource centers website. So, NIE. So, you just follow this. You can for any opportunities you can look into it. Look into the website of these resource centers or hubs for openings, any openings in HTIN. So, for example, if you open the NIE website, you may find there is a career column where you can find the openings under NIE. So similarly, we have NIRT also is one of the center. So now NIE became a hub, and NIRT is a resource center where they keep opening timely the positions that I have shown, like either health economists, scientist D, B, not B, C, D, but C and B. So similarly, under ICMR also, we have different kinds of positions. One is scientist positions and project officers and research consultants. So those who have completed PhD also, they can try for consultant positions under ICMR. So basically these are the different positions where you can apply and grab the opportunity to become part of ICMR after completion of your PharmD. So this is the ICMR website, icmr.gov.in. There will be a career column here. So if you click on the career, then you will get to see employment opportunity results and recruitment portal. Once you click on the employment opportunities, then you will get to see the different. You will end up in this page. And sorry, if you allow me, I'm sorry, I'm getting an urgent call. I will. Hello, hello. డాడీ నేను కాల్ చేస్తాను 2 minutes. నేను ఫోన్ చేస్తాను సెషన్లో. Sorry. Uh, once you click on the employment opportunities place, then you will end up onto this page. Okay, there where you can see institute name, status, and category. You don't have to go to these filters. But if you want to specifically looking for any particular institute, you can click on the institute name, and the list of institutes are available, ICMR institutes. Then, for example, if you want to see any particular category, any permanent position or temporary positions, you can check out in the website. And these are the ones you know if you come scroll down, then you will get to see the different positions that are open currently with ICMR that you can check out here. Yeah, so take home message is that economic evaluation is an important tool for evidence informed decision making in India. So similarly, HTA is one of the good opportunities available for pharmacy holders, including the PhD holders. Yeah, and we have a lot of scope in health technology assessment as well. As I said, they have 25 resource centers across India, and all these institutes they keep opening one or the other positions. You can keep check on their website, and then yeah, you may find very good opportunities. Thank you for being so patient, and if you have any queries, I'm happy to answer. Maybe I will
If
stop
anyone
sharing.
if anyone have any question, you can put your question through in the chat box. Sir will answer your question.
Maybe next time I will talk more about technicalities of the economic evaluation and HTA. So, considering the time and the scope of the workshop, and as I discussed with the organizers, they thought discussing about the career opportunities would be more helpful for you. So, yeah. If anybody want to ask any kind of question, be it career oriented or technicalities or my profile, anything. Feel free to ask any question. Your question might help so many other people also. Okay, great. Dr. Gauri was asking after completing PharmD how to initiate, I mean, pursuing a career in HTA. Great. So so to get a more opportunities in HTA, if so you all know that in fifth year of PharmD you have dissertation, right? So in the dissertation, if you choose something related to health economics or pharmacoeconomics, that will open you know your way to HTA. And I mean, even during you know internship also you can perform some studies or do some publications in the area of pharmacoeconomics. That will be helpful, and that will be an easy way to enter into HTA, because very few people know about HTA and health economics in India right now. So if you have any basic understanding about these concepts involved in HTA or health economics, that will greatly help you to get into HTA. Yeah. But yeah, provided there are openings in these institutes. Now they have 25 centers, but every year they keep increasing these number of centers. So every year you will get to see one or the other opening, definitely. I can assure you that. Because they have bigger targets to achieve. And these centers they keep opening one or the other institute. And fortunately we have these centers across I mean across India. It is not like concentrated in one part of India. You have it in Tamil Nadu, Kerala, Andhra, Karnataka, Maharashtra, Madhya Pradesh, Odisha, Rajasthan, just you name it, all the state. Apart from I mean there are few in northeastern part and eastern part of India, but otherwise yeah, one of the institutes are there like Shillong. Maybe they are going to establish in Assam also in upcoming years, in UP, Bihar, everywhere. Not in Bihar, but yeah, UP. UP it is there, Chandigarh it is there, and they're looking in Jammu, Uttarakhand is there, and Delhi, of course. Yeah, there is a lot of scope. Career growth in HTA. So, Ravi Raja was asking what is the career growth in HTA. So, as I said, there are very limited, people who have expertise in HTA right now in India, and most of them, there are good opportunities in private sector as well. For example, companies like IQVIA nowadays and all, they are recruiting people who have HTN experience. So there is a wide scope, definitely, and growth is, yeah, whatever you're expecting, I think it will fulfill in terms of monetary benefits, in terms of technical aspects, yeah, both.
Sir, I think that's all from the participant end. So I'm happy to extend a heartfelt thanks to Dr. Jagadish sir for an engaging and thought-provoking session. The knowledge and perspective you shared with us are undoubtedly sparked curiosity among our participants. And once again, thank you, sir, for your valuable session. And happy
Thank
to
you very
connect
much.
with you.
Thank you so much. If anybody have any queries, maybe they can reach out to me. I will drop my email ID, personal email ID.
Sure, sir.
Thank you so much. Thank you. Bye.